Welcome to the Libman Education Coding Clinic Commentary Update for ICD10 CM and PCS, fourth quarter 2025. My name is Faye, and I will be hosting this session of our update. Type 2 Diabetes Mellitus Without Complications in Remission. What is the definition of remission? It's achieved when a patient maintains an average blood glucose or an HbA1c level of less than 6.5% for at least 3 months after stopping all glucose-lowering medications. The duration of remission may last months to years, depending on the individual, and it may relapse if a healthy weight is not maintained, physical activity decreases, or dietary guidelines are not followed. The term type 2 diabetes mellitus in remission must be explicitly stated by the provider. Phrases such as history of type 2 diabetes mellitus or resolved type 2 diabetes mellitus are not synonymous with type 2 diabetes mellitus in remission. ICD10 CM code E11.A type 2 diabetes mellitus in remission is not reported when the patient has active diabetic complications. In order to identify our type 2 diabetes mellitus in remission, we have a new code, E11.A, type 2 diabetes mellitus without complications in remission. Here we also find and excludes one note, type 2 diabetes mellitus with complications, and type 2 diabetes mellitus without complications, not in remission. We have two questions on diabetes mellitus type 2 in remission. And the first one is a patient with type 2 diabetic chronic kidney disease, stage 2, has a history of bariatric surgery performed due to morbid obesity. The patient has lost a significant amount of weight, is no longer on anti-diabetic medication, and the provider documented that the diabetes is in remission and that the chronic kidney disease is stable. How is this encounter correctly reported in ICD-10 CM? Coding Clinic advises to report codes E11.22, type 2 diabetes mellitus with diabetic chronic kidney disease, and N18.2, chronic kidney disease, stage 2, mild. Coding Clinic explains that although the provider documented diabetes in remission, this patient has chronic kidney disease associated with diabetes mellitus. Referencing the excludes one note at E11.A, type 2 diabetes mellitus without complications in remission, codes for type 2 diabetes mellitus without complications E11.0 through E11.8 cannot be reported with code E11.A. Also, Coding Clinic tells us that code Z98.84, bariatric surgery status, may be assigned for the history of the bariatric surgery. Our next question regarding type 2 diabetes mellitus without complications in remission is a patient with type 2 diabetes mellitus has a prior history of bariatric surgery to address morbid obesity. Following substantial weight loss, the patient no longer requires anti-diabetic medication, and the provider has documented that the diabetes is currently in remission. There are no indications of diabetic complications at this time. Coding Clinic advises to report codes E11.A, type 2 diabetes mellitus without complications in remission, and Z98.84, bariatric surgery status. This concludes the Libman Education Coding Clinic commentary for fourth quarter 2025. Thank you for joining us for this presentation. If you have any questions or comments, we would very much like to hear from you. Stay sharp, code smart, happy coding.